It's important for some people, and for others, maybe not. It's supposed to be sort of a self-maintaining system where the cerumen is made by specialized sweat glands in the ear canal, and it's there to make an environment that's inhospitable to bacterial and fungal growth. And so you need some earwax, and it's supposed to just kind of come out on its own and carry debris out with it, and you just wipe it at the outside, and that's enough for most people. But some people, due to the consistency of their earwax or maybe the shape of their ear canal, which can change with age, may end up in a situation where they need to do something to help that system stay clean. In an ENT office like mine, most folks will do a type of ear cleaning with using an instrument. So we will have something, either a microscope or a handheld otoscope, that we can look through and see what we're doing, and use suctions or little loops to scoop the wax out and remove it. At a family practice clinic generally, or a general office, you'll get an irrigation system where they use a big syringe and wash the wax out with water. Either way can be effective. And it can be not just hearing problems. Some people might have a ringing problem that has cropped up, or just a sense of pressure or fullness. Occasionally, cerumen, if it's impacted and really blocks the ear canal fully, they may get really moist in behind there and develop an infection. And so it can cause a fairly wide variety of problems. But certainly there are lots of times where you take somebody's earwax out and they're like, wow, now I can hear. So it's nice. It's a nice, easy win sometimes. Most people, like I mentioned before, will be fine if they just in the shower or after the shower with a moist washcloth on their finger, just wipe out the part that your finger will reach, and that's enough for most people. Using a Q-tip, in my opinion, is fine. I don't think that's a problem. The reason I say that is that for most people, the skin of the ear canal, once you get past the cartilage into the inner part of the ear canal that's skin directly on bone, it's very tender. So as soon as you get to that part, it's going to start being uncomfortable and you won't go further. So it's the only people I've ever seen injure their eardrum with a Q-tip have been people that were bumped or surprised while they were doing it, and caused a TM perforation. I've seen it happen, so it's not completely without potential downside, but for the most part, if you're cautious and stay around the outer half of the ear canal, it should be fine. The other downside is that sometimes the Q-tip is so fat compared to the diameter of the ear canal that it can push wax in rather than bringing it out. So there's some downsides, but a lot of people use them every day after their shower, and it's just fine. In ENT offices, we're always happy to have patients come in, even if that's their only complaint, just to get the earwax out. We're very comfortable doing that for them, and it's a service that helps a lot of people.